You ready? Okay. Pat, all right. Good morning, everyone. Thank you all for joining us. I'm here with Pat Allen, Director of the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. I'm going to start this morning by turning it over to Director Allen.
Thank you, Governor. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I'm starting off this news conference because I want to update some information we provided the Governor and the public regarding hospitalizations in Multnomah County yesterday. Yesterday evening, I was advised that the information the Oregon Health Authority had reported about hospitalizations not increasing in Multnomah County was wrong. In fact, 5 more Multnomah County residents had been hospitalized over 3 days at the end of last week than we originally documented. That addition resulted in a total of 14 hospitalizations in the past week, not 9, as we originally believed. While this number was a smaller decrease than we expected, we were also concerned that these new cases came at the end of the week, representing a small uptick that we needed to flag. In total, Multnomah County saw 29 hospitalizations in the most recent 2-week period. We made an error. The data we pulled from our public health database were incomplete and therefore wrong, and I apologize for this inaccuracy. At the Oregon Health Authority, we know that sound science and accurate data are among the best tools we have to keep the public safe during this pandemic. So is transparency. While I regret our mistake, I want you to know that we will always be upfront and open when we make one. However, this error does not change our recommendation that Multnomah County should proceed with phase 1 of reopening. Let me explain how the error came about and why I'm not reversing our recommendation to the Governor. Data on COVID-19 hospitalizations is stored in our Orpheus Public Health Database, which contains a large amount of information about cases involving a wide range of diseases, literally from AIDS to Zika. Local health officials record information about cases in this system. OHA public health analysts manually pull these data for various purposes, from case investigations to statistical analysis. This manual process can be time-consuming and labor-intensive when it requires a review of many individual cases. The team has worked at breakneck pace for many months. In this case, pulling data from a large county led us to miss 5 cases we shouldn't have overlooked. Going forward, we'll have 2 analysts pull the data for key county reopening measures. They'll compare their results, and the data validation process will reduce the chances cases will be missed in the future. It will strengthen the reliability of the COVID-19 data we report. Now, here's why these 5 cases don't change our overall assessment of the situation in Multnomah County. First, the percentage of visits to hospital emergency departments for COVID-19-like illnesses in Multnomah County is 0.6%. That means 6 out of 1,000 visits to hospitals are for COVID-like illness. These visits are the best early warning signs we have of a major new surge in cases. In Multnomah County, this percentage has remained stubbornly low. Positive test percentage. Multnomah County has conducted the most tests in Oregon and has relatively low percentage of positive tests compared to other Oregon counties and the nation. That tells us there are not large reservoirs of undetected COVID-19 in the county. Case follow-up. Despite an increase in diagnosed cases, Multnomah County case investigators were able to contact 100% of people who were newly diagnosed with COVID-19 within the first 24 hours. That quick interval gives contact tracers a jump on the virus and enables them to help people who are contagious isolate themselves before the disease has had a chance to spread. And finally, hospital capacity. The metropolitan region has 392 ICU beds and 399 ventilators available. At this time, the region is prepared for an influx of patients with serious COVID-19 illness, even though we have yet to see a new wave form. We established the state and county reopening metrics for a reason. They're our best guide to safely navigate through the risk and uncertainty of an unprecedented pandemic. Yet we've always said our recommendations to the Governor are based on the totality of the evidence, not on each individual metric on its own. For Multnomah County, it's important to remember that these 5 additional new hospitalizations occurred in a county of 808,000 people. Statewide, we're down from a high point of 19 new hospitalizations per day on March 28th to approximately 7 on June 14th, the end of the last 7-day tracking period. Today in Oregon, we're seeing more cases due to reopening. We're also recording more cases in connection to outbreaks in workplaces, long-term care facilities, and other settings, and we've increased testing. We've said all along reopening comes with risks. As we reopened, we would see more cases and more hospitalizations. The question is, can we manage those risks? Can we return to more normal activities in a responsible way without triggering a surge in severe illnesses that would swamp our healthcare system and overtop our supply of hospital beds? For Multnomah County and the other counties moving forward today, we believe the answer is yes. They can manage the risks they are confronting. These counties have shown they can follow up on new COVID-19 cases, including outbreaks, timely. The buffers their healthcare systems have in place can absorb new patients. They currently have more than enough testing capacity to identify new infections. But it's not just on county or state public health officials to manage these risks. It's on all of us to take the precautions necessary to keep ourselves and our neighbors safe. Now let me turn it back to Governor Brown to talk about how we're moving forward with reopening and new measures we're asking people to take to prevent the spread of COVID-19 and our cases from increasing further.
Thank you, Director Allen. Last week, I issued a statewide pause on all county reopening applications because of rising numbers in both urban and rural Oregon. The Oregon Health Authority reviewed data from across the state, and I had the opportunity to consult with independent health experts, business leaders, and local elected officials. Thank you all for pausing with me. I know it was really hard, particularly for our businesses in the metro region. We now have a better sense of the sources of new infections. Case counts are rising largely because of workplace outbreaks, congregate care, social gatherings, and some community spread. Meanwhile, the businesses that have implemented the strict health and safety standards we've laid out are successfully protecting their customers and their employees from spreading the virus. I have confidence that businesses in Multnomah County have the capacity to implement these same health and safety standards. The rising case counts, however, remains very concerning. As we learn more about the disease, we are refining our strategies to prevent its spread. This means increased testing, strictly enforcing health and safety standards, a new face covering requirement, and calling on members of the public to remain cautious. Yesterday, I announced the following decisions. First, I am moving Marion, Polk, and Hood River counties into Phase 2, beginning tomorrow, Friday, June 19th. Second, I am allowing Multnomah County to move to Phase 1 status starting Friday, June 19th. As Director Allen mentioned, I made this decision in part based on data that indicated new hospital admission rates were not rising. I heard late yesterday from the OHA team about the glitch in the hospitalization data I had reviewed. The updated data showed an uptick in new hospital admissions in Multnomah County. I asked Dr. Dean Seidlinger, our state epidemiologist, for his guidance. He recommended that we proceed forward cautiously as always, and that's what we're doing, proceeding cautiously. Businesses in Multnomah County that reopen will need to implement the same strict health and safety standards that we have in place in the rest of the state. In addition, however, starting next Wednesday, June 24th, I will be instituting a requirement to require face coverings for the public while in indoor public spaces for the following counties: Multnomah, Washington, Clackamas, Hood River, Marion, Polk, and Lincoln counties. A county not listed that wishes to have this guidance applied in that county may request to opt in at any time. As we learn more about the disease, evidence continues to mount that face coverings play a critical role in reducing transmission. And as we adapt to living with this disease for the foreseeable future, face coverings need to become a part of our daily lives. Detailed face covering requirement guidance will be available shortly. It will be a requirement in these 7 counties for indoor public spaces like a grocery store or a shop. Currently, employees in these businesses are already required to wear face coverings. The new rule now applies this standard to customers and visitors of those businesses. There's certainly some exceptions. For example, a person with a medical condition that makes it hard to breathe or another disability that prevents the individual from wearing a face covering, as well as children under the age of 12, will not be subject to the mandate. And no, that doesn't mean you have to wear a mask while you eat at a restaurant or drink a cup of coffee. And no, you won't get arrested or get a ticket for not wearing a face covering. However, this is a requirement and it is enforceable. This requirement is a key part of how we can gradually open our economy and be able to go out and eat or browse at your favorite bookstore or shop at your favorite boutique. We have to live with this disease for a while, and that is going to require adjusting our habits, taking the simple steps of covering our nose and our mouths in spaces where we interact with others. So let me share with you why I wear a face covering. I wear it to protect our hardworking doctors and nurses working day and night in our hospitals and clinics around the state. I wear it to protect my elderly neighbors. I wear it to protect kids in cancer treatment and people with compromised immune systems. I wear it to protect the grocery store clerk and the pizza delivery gal. I wear it because I don't want to accidentally kill someone. It's really that simple. Face coverings can save lives. A face covering doesn't have to be a medical grade N95 mask. It can be something that you sew at home like this one. Don't worry, it wasn't me that did the sewing. It can be a bandana like this one. You can turn a t-shirt into a face covering like this one. And we are going to be working with businesses and local leaders and community groups to help people and businesses get access to free face coverings. The requirement begins next week on June 24th so that Oregonians living in these counties have time to get prepared. Now, let me close with a few words about what comes next. The next few weeks are going to be difficult. We will be stepping out on the ice. The entire state, as of tomorrow, will be stepping out together. We are much better prepared than we were in early March. We have increased PPE supplies. We have much more widespread testing and many more contact tracers. However, if hospitalizations spike too quickly, if the capacity of our healthcare system is threatened, we will be forced to revert to tighter restrictions. It all comes down to you, and it comes down to me. It comes down to each and every one of us. What you do every single day will determine whether our economy can stay open or if we need to go back to the way things were in the spring. Local businesses will only be able to stay open if each one of us does our part. The coffee shop, your favorite restaurant, your gym, that brewery down the street that you like, they can only stay open if you stay safe. Let me say that again. Stay safe to stay open. If you're sick, please stay home. If you go out, please wear your face covering. Keep 6 feet of distance, avoid crowds, limit non-essential travel, and stay in your local community. And wash your hands. Your actions, all of our actions will determine our future. We are truly all in this together. Thank you.
Hi everyone, it's Charles Boyle in the Governor's Office. If you haven't already, please press 0 to get into the question queue. We're going to start out with Lisa Balick from Coin. Go ahead, Lisa.
Good morning, Governor. Question, you mentioned in terms of people are supposed to wear masks yet at the same time, the question is whether it would be enforced. It's sort of a mixed message. In other words, is there a directive to law enforcement to enforce the mask?
All of my executive orders are enforceable by an act of law. However, Lisa, I am encouraging, cajoling, asking Oregonians to be kind and be smart and to protect their fellow Oregonians, their vulnerable neighbors, the folks doing the important work in our grocery stores, delivering packages. We all can make a difference here, and I want to encourage Oregonians to be thoughtful and considerate of others and wear their face coverings when they're out in public in indoor spaces.
Thanks, Lisa. Next up, we've got Kelly Azar from K2. Go ahead, Kelly.
Hi there, Governor. Just 1 second to ask my question. Sorry, we're on a delay. So when it comes to, I know you just answered the question about enforcement, and I know you're saying that law enforcement can enforce it. Our question is about businesses and restaurants. Can restaurants, if somebody walks in, or even a store walks in without a mask on, what ability does that restaurant have? Because just to give you a little background, we've heard from some stores who have already mandated this, that some people say that they do have a health condition where they cannot wear one, and because of HIPAA requirements, they're no longer allowed to ask. So bottom line, what are businesses allowed to do in these situations if someone walks in without a mask on?
Thank you. I'm going to have Dr. Seidlinger answer that question.
Thank you, Governor Brown. I think more guidance will be forthcoming next week, but the directive to require a face covering in these settings means that business can refuse entry to someone. For individuals with medical conditions who cannot wear a face mask, they have the right not to wear a face mask and to be allowed in that business. We will outline more of this in the guidance that's forthcoming, but businesses do have the ability to help enforce this and to tell their customers that they take the safety of not just their staff but their other customers seriously, and to refuse entry for that person.
Thanks, Kelly. Next up, we have got Nick Budnick from the Portland Tribune. Go ahead, Nick.
Thank you, everyone. Dr. Seidlinger, Governor Brown gave a general explanation for what you have concluded the reason is, what the reason is for the surge. Can you provide more details about specifically what is driving the increases? Which of the several possibilities the governor outlined are the leading ones, and any numbers you can provide? Thanks.
Thanks, Nick. I'm going to let Dr. Seidlinger respond to that question.
I think as Governor Brown laid out, the drive in increased cases is really coming from multiple sources. As people across Oregon have heard, we have large outbreaks associated in Lincoln County as well as Union County. These large number of cases associated with one outbreak certainly can drive day-to-day totals, and we're seeing other workplace and congregate care setting outbreaks that are continuing to occur. In addition, a number of the cases that are identified by local public health and reported to them, we have not traced back to a source. So this community spread does remain a concern in Oregon, and we are hoping to keep that number down. And we keep a close eye on that to make sure that we're not seeing cases that are not identified to a source. As Governor Brown also mentioned, there's spread associated with social gatherings. And we've seen this especially since Oregon has started to reopen activities, that people want to get together with their friends and families and do so, and have been doing so in increasing numbers, and so we've seen spread in these settings. So really, that's a place where we can all take steps to protect ourselves and those friends and families around us. Trying to maintain some distance when we're in those settings as we catch up in person again, wearing face coverings when that can't be done, trying to move those activities outside and enjoy the sunshine where we can spread out a little bit and be safer than inside our house or apartment, are all things that we can do together to help drive those numbers down. But we're really seeing that spread come in multiple places, and we continue to work with our local public health to do those investigations, but really implore everyone to take some steps to protect themselves while they're out in the community.
Thanks, Nick. Next up, we've got Patrick
Thank you. So first, a technical question just on the Multnomah County hospitalization numbers. Could you go over those for us? Because on their website, it says for the week starting May 31st, there were 15 hospitalizations, and on June 7th, there were 8. So I'm wondering if the numbers you're referring to are more recent than that?
Thank you for that question. This is Dean Seidlinger. We pull our data on Wednesday mornings and pull that data with a 2-day lag so we can make sure some investigative data is added in. During that period, in the 2 weeks preceding Monday, there were 29 hospitalizations over that 2-week period in Multnomah County, with a slight uptick in cases towards the end of the week. And it's some of those last few cases at the end of the week that were not in our refresh table that we analyzed yesterday. So that full number is 29, and that data, again, is pulled on Wednesday through Monday morning.
Okay, thank you. And then a follow-up for the governor, if I could, and it's a kind of a two-part question. But one, Governor Brown, what changed over the last week that gave you the confidence to allow Multnomah County and the other counties to go forward? And then secondly, what are your thoughts on Union County, where there's a large outbreak apparently tied to a church that had a large meeting when those meetings were banned?
So my thoughts and heart is with the folks in Union County. As you've mentioned, they have a very serious outbreak that is impacting their community, and it is particularly community members who are vulnerable to the virus. I applaud the actions of the Union County commissioners. They're taking swift action, and their local county public health is working very closely with the state public health officials. So, we're hoping they can get this under control as quickly as possible, and where we are here to support them should they need additional, working very closely with the state public health officials. So, we're hoping they can get this under control as quickly as possible, and where we are here to support them should they need additional assistance and additional services. In terms of why the decision to begin the process in Multnomah County of moving forward, a couple of reasons, but for me the pause was an opportunity for our epidemiologists, our medical experts to take a look at the data and really understand where the rising number of cases are coming from. And what we know from the data is that they're basically coming from a couple of places. We know that it's coming from workplace outbreaks. A really good example of that is the seafood processing plants on the coast and other agricultural production facilities. We are seeing rising cases in our congregate care facilities, in both, frankly, our assisted living facilities and in some of our correctional facilities, and then social gathering. And then the fourth piece is community spread, and we don't have that. What we do know is that the businesses that have opened, whether it's restaurants or hair salons, have implemented the really strict health and safety standards that we laid out, and as far as we know, are successfully protecting their customers and employees from spreading the virus. So from my perspective, I think it makes sense to treat the entire 3 counties as a tri-county region. People don't stop at the border of Washington County and say, oh, no, I'm not going to go to the restaurant in Washington County that I want to go to because it's across the county border. So it's a very pragmatic solution. We'll be treating the 3 counties, the tri-county area, as a region. And I am adding the additional requirement of face coverings to make sure that fellow Oregonians are protecting their neighbors and family members. You want to add anything to that? Okay.
Great, thanks, Pat. Next up, we have Rachel Monahan from Willamette Week, and just a reminder to folks, please press 0 to enter the question queue. Having a little trouble with Rachel's phone here. Nikki, can you unmute Rachel? Try next, Brandon Kelly with KPTV. Go
Can you hear me?
Yes.
Wonderful. We've heard from a lot of readers who are very curious. Governor, you mentioned that there's been increasing evidence, I think a lot of Oregon, that masks are effective in decreasing the spread of COVID-19. A lot of Oregonians apparently haven't heard about that evidence or are very skeptical that it actually exists. What can you tell us about where you're finding that evidence and what it shows about the importance and the efficacy of everyone in those 7 counties wearing a mask whenever they are in the public indoor space?
Thanks, Betsy. Appreciate the question about the scientific data around face covering. So I'm getting my data and evidence from the medical advisory panel and the medical experts on that particular panel, as well as folks at the Oregon Health Authority, epidemiologists, and medical professionals. I also am seeing it in the reading I'm doing. We know that countries across the world that have a national response and are either ordering or strongly suggesting their residents to wear face coverings have been very successful in slowing the transmission and flattening the curve of the virus in those countries. And I'm happy to turn it over to our resident expert, Dr. Seidlinger, to give more details.
Thank you, Governor Brown. I think we have very good evidence from laboratory settings that different barriers can prevent the spread of disease, can contain the virus, such as the virus that causes COVID-19 behind that barrier. In addition, as Governor Brown said, in countries and communities where it's kind of the norm and that wearing masks in general in public is part of the response or is part of the culture in general, we've seen decreased spread of COVID-19, and that's regardless of some other policies. So those masks really do work to help contain the virus. Using a mask in this way is not foreign to us here in the United States. We typically do it in healthcare settings. If someone comes in who is coughing or otherwise showing symptoms of a disease, we will ask them to put on a mask while they're waiting in the waiting room and being escorted to their room. This is really an extension of that policy as we've learned more about the spread of the disease from people without symptoms. So we can't just ask people to stay home when they're sick, or if they go out when they're sick to go to the doctors to wear a mask, because we know some people aren't showing symptoms. So putting on this mask helps keep much of that virus behind the mask, so when they're out near someone, their ability to transfer that virus to someone else is much lower. So we're seeing more evidence of that every day from other countries, from other communities that have implemented this policy, and we hope that Oregonians will continue to heed our advice and take these steps to protect not just themselves and their families, but their broader communities.
If I could just add a little bit to that, I think some of the confusion and challenge around this is that people are out there looking for the study that shows that wearing masks is the one thing that's going to take care of this, or that contact tracing is the one thing that's going to, stop the spread of the virus, or testing is the one thing. There is no one thing that you're going to find evidence for that's going to say, if we only do that one thing, then everything is going to be fine. It's a layer of a bunch of things that we need to do. It's staying home when you're sick, covering your cough, washing your hands, answering a call from a contact tracer, wearing a face covering. All these things layer together. And so if you're out there looking for the study that's going to show you the one thing to do and proves that if only you do that, the problem's going to go away, you're not going to find that one study. And I think that's part of what drives some people's confusion.
Thanks, Betsy. And folks, it sounds like we had some trouble with the phone line, but it's working for people again now. So if you dial back in and press 0, you can get back into the question queue. Looks like Rachel is back on. Rachel, are you there?
Yes, I'm here if you can hear me.
Yep.
Can you hear me?
Yep.
Okay.
Yes.
So I'd love to hear a little bit more about your thinking around the mask requirement. What made you choose those 7 counties and not institute it statewide, particularly, Union County, for example, where that outbreak is? And also, why did you choose to exempt the age children under 12? Does that mean you're not going to require masks for kids to go back to school in the fall?
Thanks, Rachel, for that question. I think my response to the question of why these 7 counties is quite simple. One is the population density and the ongoing spread of the virus and the vulnerability of the communities there. I will say at least one of the counties I'd had ongoing conversations with their local elected officials and knew that there was support in the county commission for including that particular county. I will just say that detailed guidance will be forthcoming in the next couple of days. The exceptions for people who have disabilities or medical conditions are exempted from wearing a face covering, and also children under 12, and I think that's consistent with our education policy. In terms of Union County, if the county commissioners asked me to implement a face covering requirement for Union County, I will do that. But I assume you've spent time in remote rural eastern Oregon. The population density is substantially less than it is in the metro area. And as one of the county commissioners said to me, they feel like 6 feet is too close. So.
Thanks, Rachel. Looks like we've got Brenna back. Brenna Kelly with Cable TV. Are you there?
Hi, do you have me?
Yes, thank you.
Hi, this question is for the governor, please, regarding the protests happening in Portland. You mentioned case counts are rising largely because of a few factors, including social gatherings. Does that now include protests? And I understand you won't be arrested or ticketed when this mandate begins next week, but it can be enforced. So what is the plan if protests are still continuing next Wednesday and people aren't taking health precautions? And what's your message to community members who have been following mask guidelines and social distancing?
Well, my comments to community members who are following the physical distancing and face covering requirements, good on you. I hear your clarion call for justice and equality in this state, in this country, and I think it is a call that we all must heed. In terms of those folks that, whether they're protesting for racial justice or for example, Trump supporters opposing my stay-at-home orders. I just want to encourage you to wear face coverings. We know they make a difference. We know that maintaining physical distance makes a difference. Obviously, coughing and sneezing into your elbows helps prevent the spread of COVID-19, but it also prevents the spread of a cough. So it's very thoughtful and very considerate, and continue to wash your hands or use hand sanitizer. So that's my message. I think it makes sense to protect your friends, your colleagues, your fellow protesters. I don't know, Dr. Seidlinger, if you want to add anything to that.
I think with our local public health partners, we continue to monitor the situation and ask about attendance at large gatherings. We're not seeing a large association between attendance at these gatherings and our current cases. We are encouraged when we see pictures of demonstrators maintaining some physical distancing and wearing their masks. I think we have more compliant folks here in Oregon with that, and I think if that continues, that's a great way to protect those around you and to protect your family when you return home.
Thanks, Brenna. Next up, we've got Bill Fuller with a statement. Go ahead, Bill.
Yeah, hi. So with the rising case count in Marion County, especially over the last week, what was the impetus to move the county forward?
Thank you for that question about Marion and Polk County. As you know, we are treating these two counties that share, I would just say, a lot of economic ties as a region, calling it the bi-county region. From my perspective, we're seeing the case increases in basically 4 areas: congregate care facilities, workplace. Obviously, we're seeing it in non-identified, and we're seeing it in workplace. I'm just remembering the third one: congregate care, assisted living facilities, and social gatherings. I knew I'd get there. So what that tells us is that the businesses that are open, the restaurants and the hair salons, are doing a really good job abiding by safety precautions and health measures. And so that's a good thing. I don't know if either Dr. Seidlinger or Director Allen can speak to specifics in terms of the guidelines in Marion and Polk County.
I will just say, as we look at the data in Marion County, they are impacted by several outbreaks, including one associated with the Department of Corrections, which is fairly well contained from the community. They were also at the forefront of having to interact and work on, investigate several agricultural worker outbreaks, and that continues. They've done tremendous outreach to the community with their clinics and community-based organizations to reach the population most at risk, to get them messages about precautions they need to take, and working with employers. So while we do continue to see cases in there for the reasons Governor Brown outlined, there is a strong outreach and messaging for residents in that community, particularly some that were harder to reach with our traditional messaging.
Thanks, Bill. Next up, we've got Shane Dixon-Cavanaugh from Oregonians. Go ahead, Shane.
Hi there. Question for Dr. Seidlinger. So last week during the press conference, you mentioned that the Oregon Health Authority knew of no cases that involved patients who said they attended a recent protest or demonstration. We just heard you say now that the state has not seen a, quote, large association connected to recent cases. But can you give us an actual number or figure as opposed to speaking in generalities? And secondly, can you sort of, this is sort of a technical question, can you detail how the Oregon Health Authority is tracking or monitoring cases connected to demonstrations or protests? Because we're hearing from some counties that they're actually not sort of systematically following that. So how's the state doing that?
So I'll start with that second part first. We have done outreach in our regular phone calls and interactions with county and tribal public health authorities that as they investigate cases of COVID-19, asking about participation in large demonstrations or protests is something that we're encouraging. We know that counties have implemented that in different ways, and we know that people can be fearful when public health calls, and particularly sharing information, as there's been some misnomers on social media and out there about don't give this information to people when they call because they'll hold it against you, and that's not the case at all. We'd like to identify if there are people who are attending a specific event and are there at the same time that there could be increased risk for spread, and we have not seen any evidence of that with cases who've gone to a protest in a particular area, a demonstration on a particular night that have shown cases. We have had some reports where protest attendance has been mentioned in the case notes, but we don't have any definitive evidence of spread in those protests because we haven't seen more than a couple of cases overall across these protests. And again, that's incomplete data because we know it's not all shared with us, but we do encourage our local public health to ask that question, to put it in the case notes so that we can identify clusters and report where someone may have been at risk, but we're not seeing that now. And we've had several weeks of data to be able to look at and aren't pulling out numbers like that. So in answer to your other question, I don't have a specific number. I only know of a couple of case reports where that has been mentioned, but again, no definitive link of getting infected or getting exposed when they're at one of these settings, though certainly with the numbers of people that are out there, it is likely that people have COVID-19, and hopefully they don't have symptoms and they would be staying home, but they can spread it. So if you're attending these protests, if you're attending a demonstration for whatever reason, take some steps to protect yourself, those fellow folks around you, and really to protect your family as you return home by staying 6 feet apart when possible and wearing a mask.
Thanks, Shane. We've got time for a few more questions. We're going to try Kenneth with the Newport News Times. Go ahead.
Hi, thanks. Rachel actually asked my question about the selection of counties, but the governor mentioned having communicated with county officials that were supportive of a face covering requirement. So I wanted to ask if that was Lincoln County that she spoke with. And I'm also curious about the timing, why the face covering requirement wasn't instituted earlier.
Great question, Kenneth. Yes, Lincoln County was one of the counties where I'd had multiple conversations about the face covering issue, and heard that the county commissioners there were extremely supportive of me, including them in this order. In terms of why it took so long, well, I've been recommending face coverings for Oregonians going out in public buildings for many weeks now. When I last spoke about it, I think I was hopeful that local electeds would take action. That did not happen, and given that we are seeing a percentage of cases in the community spread arena, it made sense to me to make this decision at this point in time. That based on the scientific data, is substantially increasing around wearing face coverings.
Thanks, Kat. Last question is from Kelly Hazar with K2. Go ahead, Kelly.
Hi there. Can you guys hear us?
Yes.
Okay, great. This question is for the governor. You were just speaking about face masks and concerns surrounding them. I know Multnomah County is one county, and I believe the tri-counties have been concerned about a face mask mandate. Their concern surrounds not only those health concerns you spoke of earlier, but equity and a lack thereof. What would you say to people who are concerned about equity concerns and wearing a mask?
That's a really good question, actually. And for those, I don't know if that folks could hear the question. And the question was, how do you address concerns regarding equity in terms of face coverings? I will say that I have been listening to a number of folks in the African American, Black, and Latinx communities over the last several weeks, and it obviously is a concern, and that's why we are committed to working with businesses, local leaders, and community-based organizations to ensure that face coverings are ubiquitous, available, and no cost. There are also obviously racial implications in terms of face coverings, and the folks I have spoken with, from folks on my staff to leaders of community-based organizations in our communities of color, our African American, Black, and Latinx communities primarily, overwhelmingly support this proposal.
Thanks, Kelly. And we've actually got one more follow-up question from someone who's having technical difficulties. Lisa Bitcoin asks, how soon will you go out to shops and restaurants, say, for a sit-down meal?
Me? Okay.
I already have. Yeah.
Director Allen already has. I confess, I am living in Marion County, and I've already had my hair done, and I know that my